Hello, Warriors. This is Jody with Warriors Rise. I have an amazing guest today. I'm really excited about this topic. But before we go into the topic, we always start with a prayer. So let's go to the Lord. Father, we just thank you this morning for your presence, for your goodness. I thank you, Lord, for the men and women that go out and work hard to find ways to help others, Lord, not just spiritually, but physically. We welcome your spirit here and we thank you for your goodness and your mercy. In Jesus' mighty name, amen.
Amen.
Thank you for being here. So, my
For
guest
having me.
today is Dr. Nathan Bryan, and you are a biochemist and you began to study in molecular medicine, correct?
Correct.
So, let the folks know, really important too, when I was bragging about you coming on, I was really excited. Oh, I can't wait for you guys to hear this. Somebody said, "Isn't that a nitrous gas dangerous?" I said, "No, this is something different than
That's
that."
something different. Yeah, that's right.
So, introduce yourself and then explain how you got here and then the difference between nitrous and nitrix. So,
Well, thank you, Jody. It's a great pleasure being with you. Thank you for your service and thank you for that opening prayer. It really means a lot.
yeah.
Now, I'm a small town Texas boy. I grew up in just outside of Austin. Got a degree in biochemistry from the University of Texas at Austin, and then from there I went to LSU School of Medicine, where I completed a Ph.D. in molecular and cellular physiology. Then I did additional training as a postdoctoral fellow in cardiology and vascular biology at Boston University Medical Center. So I was introduced to this whole science of nitric oxide back in the late 90s after a Nobel Prize had been awarded for its discovery. And, for those of you who don't know, the Nobel Prize is awarded every year. It's announced in October. So in a couple of weeks, we'll have this year's Nobel Prize winners. But it's for discoveries that have the potential to change mankind. And so these are fundamental, foundational discoveries that really change the trajectory of science. In this particular field in physiology or medicine, it's really in medicine.
Yeah.
So, the nitric oxide was discovered to be a signaling molecule in the cardiovascular system. It's a gas, so an interesting new concept or paradigm in cell signaling.
All right.
And even in 1998, there was a lot, we knew a lot about nitric oxide, but, there was still a lot we didn't know. We didn't know how to detect it in humans. We still really didn't have an appreciation for how the body made it. And we certainly didn't know what led to a natural loss of its production.
Mm.
But going back 25 years, the literature told us that the loss of nitric oxide is really what leads to the onset and progression of chronic disease. So, that started my interest, and I trained under a pharmacologist, had been in nitric oxide for 20 something years. And then, I was recruited by one of the guys who shared the Nobel Prize, Fred Muret, to start my first faculty position in independent research career at University of Texas Health Science Center, Houston. And for the first year and a half, all I did was I had these concepts, I had these ideas that if we could determine how we could produce nitric oxide gas, then we had a chance to start to, develop some pretty important product technology that could overcome nitric oxide deficiency
Right.
in the billions of people that are nitric oxide deficient. So I
Wow.
started filing patents with the university. Before long, the patents started being issued. Interestingly, there weren't a lot of people interested in licensing our technology. And the
Right.
typical academic model is, you take discoveries, you license it to existing companies, and that's kind of the path of least resistance,
Mm.
at least for monetizing and commercializing discoveries out of academic institutions. But nobody was interested in what I was doing. So my philosophy has always been, if it's to be, it's up to me.
Right.
So I became an entrepreneur, and I started my first company in 2009. We licensed my technology from University of Texas, and really brought to market the first and only nitric oxide releasing product technology. And now fast forward 15, 16 years, I've got a number of companies out there. We've got a number of products. We're developing drug therapy now based on these discoveries to
Wow.
really address many poorly managed age-related chronic disease like heart disease, Alzheimer's,
Mm.
diabetic ulcers, non-healing wounds, even metabolic syndrome. Nitric oxide has an important and a really amazing therapeutic potential
Wow.
there. So that's what started me in this field. And, here I've been doing this for 25 years. I've published over 100 peer-reviewed papers in the published literature. I give 30 or 40 lectures every year all around the world. And I think I've given over 400 lectures now in
Wow.
my career. So it's really rewarding and gratifying knowing that, just like you and probably your audience, this is probably the most important molecule that they've never heard of. And
Right.
so for me, it's about education and building awareness.
Right. So now, very quickly, the difference between the nitrous oxide.
Oh, Yeah, no, that was the original question. Sorry, I got
Yeah,
lost.
yeah, yeah. No,
So
no.
nitrous oxide is the dental anesthetic. So that's laughing gas.
Okay.
That has a molecular formula of N2O. What we're talking about is also a gas, but it's nitric oxide.
Right.
It's not NO, one nitrogen, one oxygen molecule. So they sound similar, but the physical and biochemical properties are completely different.
Okay. And nitric oxide we use in our bodies. It opens us up for more oxygen. And they're trying to use oxygen therapy now. So here we have something that can happen from the inside out rather than a mask, right?
No, that's right. Look, oxygen is extremely important. The air we breathe is only 21% oxygen.
Mm,
And we witnessed this during COVID, right? So people developed hypoxemia, meaning that their oxygen carrying capacity of the red cell was diminished.
wow.
And so the typical therapeutic kind of protocol was, okay, if you develop hypoxia or hypoxemia, let's put you on 100% oxygen. And then when that doesn't work, they put them on a mechanical vent. They develop metabolic acidosis, and many people die
Right.
unnecessarily.
Hmm.
But based on the discoveries of a very important paper in 2015, it was discovered that nitric oxide is part of the cardiopulmonary cycle.
Wow.
So we need nitric oxide to bring oxygen onto hemoglobin, and we need nitric oxide to deliver oxygen in the periphery. And we had a drug in phase 3 clinical trials during COVID. And what we witnessed was that if we had patients that developed hypoxia, so that means their blood oxygen saturation. So these are the pulse oximeters you put on your fingertip. It measures blood oxygen saturation. So then, if your blood oxygen saturation got below 90, say 88, that was considered somewhat critical, and you needed to go to the emergency room or go see a physician.
Mm.
We had patients, and this was an outpatient study, that they had hypoxia or blood oxygen saturation in their 70s.
Wow.
And then we would do remote telemonitoring, and we would tell them, hey, well, take your study product, your study medication, and we could monitor in real time, and we would see their blood oxygen saturation go to 96 within
Wow.
8 minutes. So and again, this is breathing room air, 21% oxygen. They weren't on supplemental oxygen. They certainly weren't on mechanical vent.
Right.
So this demonstrated to us and the entire scientific community that we're not out of oxygen. We've lost the ability to take up oxygen and deliver oxygen to the periphery, because the people who got sick and died from COVID, same people get sick and die from influenza every year, are the people who can't make nitric oxide.
Right.
The elderly, people with diabetes, previous heart attack, kidney disease, renal disease, heart failure. These were the susceptible populations that got sick and died from COVID. So to answer your question, we just have to replete nitric oxide production. Now the body's able to take up oxygen, deliver oxygen efficiently, and overcome this hypoxemia and fully oxygenate tissues, get cells the nutrients and oxygen they need so they can make energy and do their job.
Right.
And that's the basis. That's the mechanism of addressing all age-related chronic disease.
Right.
And if we look at the hallmark, the common denominators are that it's always low blood flow, it's always inflammation, oxidative stress, and immune dysfunction.
Mm.
And nitric oxide addresses all four of those. It dilates the blood vessels, improves blood flow circulation, it decreases inflammation, inhibits oxidative stress, and corrects the immune dysfunction we see in chronic disease.
Right. And people don't just want to take this on themselves, because I've heard you in other interviews when I found your interviews where you said they really should come to your site and pay attention to the directions, because if they take too much, their blood pressure can drop. So you want to do this right, so you're actually helping your body. So we have too many doctors out there that aren't licensed.
No, that's right. Google Doc can, I think it's informative. There's a lot of information out there, but there's also a lot of misinformation.
Right.
So what I try to do, and someone who's been in academia and basic science for 25 years, or really going through my academic education and training probably in almost 40 years now,
Yeah.
but to take the information and impart knowledge based on information. And that's really the key. Information is not knowledge.
Right.
Right. And so there's a lot of misinformation out there that people can take in and do the wrong thing and really, harm themselves or harm people when they really have good intent.
Right.
That's why it's important that you pay attention to the science and not just people out there who really don't have a pedigree, don't have any credentials,
Right.
and giving you medical advice. And, this isn't medical advice. This is based on our product technology, and what we do is based on sound science that's been validated and proven out in randomized placebo-controlled clinical trials. And so dose dictates poison. So it's very important that you follow the instructions and the directions for use.
Mhm.
because you don't want to overdo it. I mean, at what we're doing in kind of the consumer market, it's really difficult to overdo it, but you can. And
Right.
it'll lead to an unsafe drop in blood pressure, and it can cause a condition called methemoglobinemia,
Mm.
and it can cause some problems. But we haven't seen it, we don't see it, but we obviously encourage people to use caution with anything.
Yeah, exactly. So now, did you run into any trouble? Like I've had people on, we know that apricot seed and things can heal cancer now, and those those people who came out with that in the 70s and stuff, their licenses were taken away, they were arrested. Now you guys are coming out with you are coming out with something here. You've given up, you've stepped away from your practice and retired, right? And now you're trying to get this information out because we need to know it. God made a plan for healing in our bodies right out of the easiest things. It's not these giant drugs with all these fillers that,
Yeah,
and I'm one, and we had a brief conversation about it. I've had 18 surgeries. My spine was injured in the military. And so I have titanium and rods. I've got stuff missing, like, no gallbladder and all. And so, sometimes I'll take these medicines. They make me sicker
yeah.
than the issue. So, when you were coming out with this and your studies and everything, did you face trouble? Like, did they try to stop you from bringing out this information?
Yeah, look, what we do is very disruptive. And anytime you have disruptive technology, there's resistance.
Right.
But, if you look, there's a quote that I always use by Schopenhauer, a 16th century German philosopher. He says that all truths go through three phases.
Mhm.
First, it's ridiculed. Secondly, it's violently opposed. And then third, it's accepted as being self-evident. So
Mhm.
what we've discovered here are fundamental truths on biochemistry, physiology, and how God designed us.
Mhm.
So, of course, I've been ridiculed. Of course, there's been violent opposition. And that gives me 100% confidence that these are truths. And so, what's the third stage?
Yeah.
It's
Accept.
self evident.
Yeah, it's
And
open.
so, unfortunately, the practice of medicine, if you got an offending part, like your
Mhm.
gallbladder doesn't work, they want to take it out rather than address the reason why that gallbladder or that organ isn't functioning.
Right.
And then they want to give you a synthetic compound that inhibits a biochemical reaction. And those are
Mhm.
pharmaceutical drugs. They employ principles of pharmacology.
Right.
Right? Understand what's upregulated during a certain disease and assume that God made a mistake when he made us. So let's, in our infinite wisdom as humans,
Right.
let's inhibit that natural response to that disease or symptom.
Right.
And unfortunately, that's medicine today.
Mhm.
But what we're trying to do, and again, this goes back to my first faculty position at the Institute of Molecular Medicine, where we were charged with understanding the mechanism of disease to the
Mhm.
extent that you could develop rational therapy. And
Mhm.
so, what we've discovered with nitric oxide is we understand how the human body makes it. We know what goes wrong in people that can't make it.
Right.
And based on that, we can give the body back what's missing.
Mhm.
So, we have a drug company, what we call a clinical stage biotechnology company, but we never employ what's called pharmacology. We don't synthesize compounds that inhibit biochemical reactions.
Yeah.
We use the original philosophy of medicine, which is applied physiology.
Mhm.
And so we understand how much nitric oxide a healthy human makes in a 24-hour period. In certain diseases, we can quantify what they're making now, and then we give that back.
Wow.
So, utilizing these principles of applied physiology, we can actually give the body what it needs. The body heals itself. And when you do this, now you eliminate the need for prescription drugs, because if you restore the production of nitric oxide, you dilate blood vessels, you improve perfusion, you normalize blood pressure, you normalize cognition, you enhance performance, human optimization, inflammation goes down, immune dysfunction goes away, and you inhibit oxidative stress.
Mhm.
Which again, those are the symptoms of every age-related chronic disease.
Right.
So now, when you look at the bigger picture, and these for-profit pharmaceutical companies that participate in $1 trillion global business on getting people on drugs and as many drugs as they can for as long as you can, because the number one rule of business is acquire as many customers as you can and keep those customers as long as you can.
Yeah.
And big pharma is the best in that model of any business model in the world,
Right.
but it's to the demise of our own health. And so we have to correct that. So
Mhm.
yeah, what we do is very, very disruptive. I've been sued. People have come after me. They've tried to stop me what I'm doing.
Mhm.
But I'm the truth is on my side. Everything we do is based on science, and I'm focused on doing the right thing. I don't focus on making money. I don't focus on doing what's most profitable for our companies. I let the science lead the way. And what I've learned in 20 years as an entrepreneur is when you do the right thing, the cash register rings. But
Yeah.
I never focus on ringing the cash register.
Right, right. And they do, Big Pharma does. And they don't really, I feel like they don't really care about the person because when my back was broken, I had like fibromyalgia type nerve damage from
Yeah,
the injury. And they would not prescribe me the medicine that the doctor thought would be best to help with that. And so I called the company and I said, tell me what I need. And they said, well, we're not doctors. I said, yeah, but you're telling me what I can't have.
that's right.
So I mean, so big to me, I have just, so now I've been really working hard to pay attention in my 63 years here finally to what is natural for healing. So this is why I loved when I saw your interviews and I was like, oh my goodness, I have to have him on the show. One of the things that you spoke about was you healed your dad because my grandma
Right.
had diabetes. I had diabetes at one point. They had me on so many drugs that I gained. I'm tiny. I'm like 5'3", and I'm
But
a
a
little,
warrior, right?
yeah, right. I'm a little Marine. I'm just like tiny little tough, ball of fire. But what happened was that medicine, 12 to 14 pills a day, boom, my face grew, my body grew to over 230 pounds. I
Oh my
said,
God.
you people are killing me. I knew it. I could feel it. And everything that I took all the medicines and I started doing research. Everything said can cause weight gain, can cause rapid weight gain, can cause weight. I was like, I'm going to be a butterball rolling down the street if and I eventually fought it and I stopped. I started coming off their medicines and sometimes the doctors get annoyed with me because I won't take their vaxes. I won't take their.
Good for
I'm
you.
like, yeah, not doing it. You're not touching me. My God knew what he was doing when he put me together. And I would rather talk to people like you and people like the Richardsons and different people who know, the natural way that God, had healing for us.
No,
So,
for
but
sure.
your
Now look,
dad, go ahead.
yeah, no, that's the problem. I mean, that's really the norm now instead of the exception because when in our clinical trial, we had people that were on 18, 20 different medications and they wonder why they get sick all the time. I mean, the
Serious.
body is never designed to be exposed to that many synthetic compounds that are inhibiting, basic fundamental biochemical reactions.
Yeah,
So kudos to you for, I think it's important you follow, and you have to be an advocate for yourself.
right.
Physicians, I think, mostly, try to do what they know. But unfortunately, it's not the docs that are the problem, it's the system in which they're trained.
Yeah.
But yeah, going back to dad, my dad had a car accident in 1984, left him paralyzed from the mid back down, a T11 compression
Wow.
injury. So I was 11 years old at the time. And so, my brother and I had to take care of my dad for many, many years, even as young kids. And then, rolling around in a wheelchair for 40 years, being, sedentary by design
Mhm.
and, being diabetic and really some poor food choices, dad developed, like most paraplegics, pressure ulcers or decubitus ulcers.
Mhm.
And in 2013, he developed a stage 4 non-healing wound on his right butt cheek.
Mhm.
And all the wound care docs I took him to said we could never heal this wound. Dad was 60
Wow.
something years old, been in a wheelchair for 20 or 30 years, and still diabetic, hypertensive. And I just, as a son, I refused to accept that. And so I started making a nitric oxide releasing gauze. I knew enough to kind of be dangerous at the time. So I knew that nitric oxide was antibacterial, so it could kill the infection in the
Right.
wound. And then the reason wounds are non-healing is because there's not enough blood supply. And diabetics, they have microvascular disease, so there's not adequate blood supply to that wound. So you can't get your immune cells there to kill the infection and to lead to wound repair and mobilize stem cells.
Right.
So I started making a nitric oxide releasing gauze. And within a period of 3 or 4 days, the wound lit up. It was nice and pink and red. We could see the tissue granulating.
Wow.
Uh, the collagen started to disappear, this kind of shiny film over it, which prevents healing.
Yeah.
Uh, the bacterial infection went away,
Wow.
and we started to see remarkable progress in this. At that time, it was a 3-year-old non healing wound. And
Wow.
within a period of probably 8 or 9 months, we completely healed this stage 4 decubitus, osteonecrosis, osteomyelitic mylosis wound bed.
Wow.
And so that told me, and even the wound care docs, they go, wow, we've never seen this before. Whatever you're doing, we can't do. So, but we need access to this technology.
Yeah, and it should be out there. My grandmother had the with her I never got him with the diabetes I had because I fought and got rid of it.
Yeah.
But she had two big ones on the front of both of her legs, and she was in a wheelchair as well. And
But we're working on that. I mean, there's 65,000 Americans that die every year in nursing homes from wounds that become infected, and
uh,
that's unacceptable.
it is
We can do better, and we must do better.
those are somebody's mothers and somebody's grandparents. It
Absolutely.
breaks my heart. So now let's talk about uh, Alzheimer's disease.
Yeah.
Does this work to help people with that disease? Because, people that look at that and they think it's a life sentence, you know.
Yeah.
I believe with some of the things I've heard you say that there's hope. So let's share that hope with
Now,
the.
there is hope. We're really excited about our Alzheimer's drug program because, first of all, let's understand what causes dementia and Alzheimer's.
Mhm,
And it's a vascular disease and it's a metabolic disease.
mhm,
So when you look at cerebral blood flow, and you can look at this, you can image this in real time through SPECT scans. And so SPECT scans are an imaging modality that looks at perfusion of different regions of the brain.
mhm.
And in all Alzheimer's patients, there's what's called focal ischemia. There are portions of the brain that don't light up on a SPECT scan, and that's indicative of no blood flow. That part of the brain is not getting perfused. So then, if there's no oxygen, then these cells can't do their job, right?
Right,
Then the brain atrophies. And if there's no oxygen and there's no nutrients to the cell, then the cell becomes dysfunctional. You get misfolding of protein,
right,
and those show up as amyloid plaque and tau tangles.
right,
So that's the vascular component of Alzheimer's. And there's a reason the progression is mild cognitive impairment. Then we call it vascular dementia,
right.
and then we call it Alzheimer's. So it's a progressive disease.
Wow.
And then it's also been termed diabetes type 3
Mm.
because we see insulin resistance in the brain cells.
Wow.
And so we need glucose to get into those cells so that you can use it as an energy source to fuel the metabolic activity.
Right.
And my research lab was in 2011, the first to show that nitric oxide is part of insulin signaling and necessary to bring glucose into the cell. So if you can't make nitric oxide, you're not perfusing the brain, you develop insulin resistance, and that starts this entire cascade of mild cognitive impairment, vascular dementia, and Alzheimer's.
Wow.
So our philosophy is let's restore nitric oxide production. Because the interesting thing, and really the promising thing is if you look at epidemiological studies, what are the risk factors for Alzheimer's? Well, it's diabetes, it's poor lifestyle, it's smoking, it's everything that we know leads to a stepwise reduction in nitric oxide production are the exact things that accelerate and put you at risk for developing Alzheimer's.
Wow.
What protects you from Alzheimer's? Exercise, good diet, people on PD5 inhibitors, Viagra. A study came out several years ago showing that men who take once daily 5 milligrams Cialis are protected from developing Alzheimer's.
Wow.
And these drugs work through dilating blood vessels, potentiating the effects of nitric oxide, and improving cerebral blood flow.
Wow.
So everything we know from what causes dementia, Alzheimer's, is decreased nitric oxide production. If we can restore and replete nitric oxide production, we can not only stop the progression, but based on our drug study and our design, we hope to show that if we can not only stop the progression of disease, but we can actually see regression
Wow.
of disease. So if we improve blood flow, if we improve glucose uptake in the brain, we don't get misfolding of protein, we don't get the amyloid plaque, and we can overcome both the vascular and metabolic aspects of Alzheimer's. And that's what we're trying to get through the FDA now is a safe and effective drug for Alzheimer's.
Yeah, that would be amazing because I truly believe the cures are there. I think
Absolutely.
I heard you say something on an interview one time where you said that they have the proof of healing for almost every sickness. Do you remember saying that?
Yeah, I think that's probably related to animal studies, right?
Okay.
Because I was on a radio show a couple
Yeah.
weeks ago, and they said, look, they had this new drug therapy combination for curing Alzheimer's in mouse models of Alzheimer's. But
Right.
mice are not humans. And
Right.
so, we've cured every disease, every human disease in mice, right? You can just read through the literature. So Alzheimer's has been cured in mice, heart disease has been cured in mice, diabetes has been cured in mice. But
Yeah.
why is it their translation of that into humans?
Right.
And it's because mice aren't humans. And in animal studies, we control every aspect about their environment. We control their light cycle, we control their food consumption, what they're eating, their environment, everything
Wow.
about it. Humans, we can't control what people eat.
Right.
You know, we can turn genes on or off, and so you can predispose them. And you know, there's so many contributors to disease. It's spiritual, it's emotional, it's physical, it's the toxins we're exposed to in the environment, and the foods, and the nutrient deficiencies, and all that. So that's the reason a lot of these technologies that we cure in animal models and in cell culture never translate into human
Mm.
therapy, because there's so many confounding factors.
Right, the control. So, and that's something that they found with the cures for cancer as well. They'll give these people these natural things, and then they go back, oh, I'm cured, and they go back to doing what they were doing, and then they're reinfected. But
That's right.
I remember that with cure for cancer with Dr. Richardson, he the first cure that he did with cancer was a cat. So, so maybe if we go a little higher, than mice, but yeah, I heard you say that and I was like, how, but I understand that. How come we can't translate it? And it is the factors, if we're smoking, we're drinking, we're putting poisons in our body, like what's in the food. When we think, I sit back and I love hamburgers, but when I
Oh yeah.
sit back and they say that there might be 70 cows in one hamburger, my brain goes, it tastes good, but do you really want to know what's in all 70?
Well,
So,
that's why I raise my own beef, so I know what's in the beef that I
oh,
eat.
I love to, I used to live in Texas after I got out of the Marine Corps. That's where I first lived for 6 years. I love Texas. There's nothing like Texans. They're great people. But, so yeah, so the eating and finding out, go to your local butcher, let him, instead of going, because some of these meats are being flown here, or they're not even from America.
No, that's right. We still import too much beef. I mean, America is one of the largest beef producers. There's no reason to import the beef
Exactly.
we're eating.
Yeah, they're just trying to tear down the industry in our country. So I did have, so we were talking about the food, which is important, but you also in another interview I have here that you spoke about the dental and how
Oh
important
yeah.
dental is. So I'd like you to speak to that because a lot of people as they get older, you'll notice they don't take care of their teeth as well and things like that. And I think it's important because it is linked to heart issues. And but you have a whole description of, how this is important. So,
No, like chronic disease begins in the mouth. I mean, you know, we've known for over 100 years that there's an oral systemic link. So people with poor oral hygiene have higher, probably all-cause mortality, primarily cardiovascular disease.
mhm,
And so, you know, 100 years ago, we thought, well, if pathogenic bacteria, if there's translocation, and that's why bleeding gums are important consideration, because if we have bleeding gums, then it opens up our cardiovascular system to the pathogens that are in our mouth.
mm,
So you can culture oral pathogenic bacteria in a thrombus in an autopsy of a patient who died from sudden cardiac arrest.
wow,
And so that was, you know, and mechanistically we understand that now. There's if you got bleeding gums, translocation of pathogens causes systemic inflammation, upregulation of LPS, immune response, inflammation, plaque instability, plaque rupture, and that's the end of the story.
mm,
So the strategy at the time, the therapeutic solution was let's eradicate all the bacteria in the mouth. Let's put fluoride in drinking water. Let's put fluoride in toothpaste. Let's do fluoride rinses.
mhm,
And fluoride is an antiseptic.
right,
It kills all bacteria, good, bad, and ugly. It's also a neurotoxin. It shuts down your thyroid function. And now it's clear evidence now from the National Toxicology Program of the really dose escalation multi-year study was published last year showing that fluoride reduces IQ in kids by 7 points,
oh my gosh,
and it shuts down your thyroid function. And it's an antiseptic. And 73% of municipalities in the US put fluoride in the drinking water.
wow,
And why do they do that? Because it kills the bacteria in the water.
right,
So when we bathe in that water, it kills the bacteria on our skin. When we drink that water, it kills the bacteria in our mouth, it kills the bacteria in our gut.
right,
It shuts down our thyroid function. There's an epidemic of hypothyroidism. It's a neurotoxin. And so what we're finding is now, today, we know there's a microbiome.
mhm,
In fact, the bacteria that live in and on our body outnumber our human cells 10 to 1. So we as humans are 10 times more bacteria in terms of cell mass than we are human or mammalian cells.
wow,
So today we know that we have to support the microbiome,
mhm,
right? There's not a physician out there who would tell you it's a good idea to take an antibiotic every day for the rest of your life,
right,
because
yeah,
the science tells us that it causes gut dysbiosis, causes systemic disease, So if you've got an acute infection, antibiotics are extremely important. Don't get me wrong.
Mm.
But you have to be more judicious in how we use these antibiotics. But for me, as a drug discovery biochemist, is I want to develop technology that's selective to killing the pathogenic bacterium, but supports the ecology of the non-pathogenic commensal bacteria.
Mm-hmm.
So we have to support the microbiome. We can't kill it.
Right.
So what do? Well, 73% of municipalities have fluoride in their drinking water.
Yeah.
Most toothpaste has fluoride.
Mm-hmm.
And I encourage everybody, if you're listening to this, when this is over, go, if you're using Crest fluoride, any fluorinated toothpaste, read the back of your toothpaste. It says, if you swallow this, call poison control. And then only use a pea-sized amount of this toothpaste, because a pea-sized amount of toothpaste has 5 milligrams of fluoride.
Mm-hmm.
You don't even have to swallow it. Fluoride has a molecular weight of, I think, 27.
Wow.
So it's absorbed immediately through the oral mucosa. But most people I know are putting,
A whole line.
a whole bristle
Yeah.
with toothpaste. So now you're being exposed to 100, 200, 15, 20, and you're doing that twice a day,
Wow.
poisoning ourselves with fluoride.
Wow.
So I encourage you have to use a non-fluorinated toothpaste. You have to get a home filtration system to remove the fluoride from your drinking water,
Mm-hmm.
and stop using mouthwash. We and others have published that if you use mouthwash, it kills the bacteria and your blood pressure goes up because it's shutting down nitric oxide production.
Wow.
So again, going back to the premise of this, the oral microbiome and the gut microbiome, the skin microbiome is extremely important.
Right.
And we have to support it, and we can't kill it or destroy it.
Mm-hmm. That is a fact. And I talk to people and I'll say, fluoride's not good for you. I go to the VA and they give me medicine for my teeth and it's pure fluoride. I said to her, that's not good for you. She said, no, put it on your tooth every day. And I'm like, because when I was in the military, they gave me a gold cap, and then under the gold cap gets irritated. So I need fluoride. So of course I didn't do it because I'm stubborn.
Well, look, it takes on average of 17 years for new discoveries to become the standard of care.
Yeah.
It's not an excuse, it's just the facts, right? But we can do better, because when the preponderance of evidence shows that there's no benefit for fluoride exposure, and it's all risk, and not only small risk, but enormous risk, lowering IQ in kids by 7 points, then that's a very easy quotient. You just eliminate it.
Right.
And I think we're starting to get the attention. This administration is a little more progressive, I think, in making rapid changes and understanding that we can't do the things we're doing just because it's the way we've done it for 100 years.
Exactly.
We have to act on the new science.
Mm-hmm.
We have to make changes quickly, because the preponderance of evidence shows that it's not good for us. Exactly. And if we simply eliminate it, then people get better.
Yeah.
So for me, what I've learned, nitric oxide is foundational, but spending 20 years in academia, I know people get sick because of two things. Their body's missing something that it needs, or it's exposed to something that it doesn't need.
Right.
So if you get rid of the toxins, and sometimes drugs are the toxin, so you got to get off drugs. And then if you replete missing nutrients, the body heals itself.
Mm-hmm.
And that's how our creator made us.
Exactly.
That, you give the body what it needs, and, our body's a lot smarter than we are. So we just got to get out of the way.
And thank God for men like you who are a lot smarter than me to figure these things out. A friend of mine asked me to ask you about the telomeres. Does this help grow the length of the telomeres? And if you can tell people what that is, because some people don't know what that is.
Yeah, so the telomeres are the ends of our chromosomes. So in every cell in the nucleus of the cells are chromosomes. It contains the genetic blueprint for making proteins and kind of our genetic code. Mm-hmm. So the telomeres are the ends of the chromosomes. And there's an enzyme called telomerase. And as long as this enzyme is active, it prevents the telomeres from shortening. And the data, and a Nobel Prize was awarded for the discovery of telomerase many years ago, maybe a decade or more ago. Yeah. But the evidence shows that if you have shorter telomeres, you have shorter lifespan. And this has been demonstrated in both mice and humans. And longer telomeres, longer lifespan. So where does nitric oxide play a role in this? Well, nitric oxide is what activates the telomerase gene expression, and it activates the activity of the enzyme. Wow. So without nitric oxide, you don't get the nuclear expression of the telomerase enzyme, and so it can't function. So then you get shorter telomeres. Sure. If we can improve nitric oxide production and improve the upregulation of the eNOS enzyme, the enzyme that makes nitric oxide, then all cells of the body increase the expression of telomerase, and we improve the function of the enzyme. So nitric oxide, by activating telomerase activity, is preventing telomere shortening. And so that means you can live a longer, healthier life. But that's just one part of the story, right? The other is the stem cell story, mobilizing the number of circulating stem cells, which nitric oxide is the signal that tells our own stem cells to mobilize and differentiate to repair and replace dysfunctional cells.
Wow.
And then there's also mitochondrial function, the function of the mitochondria in the cell. And it's nitric oxide that controls mitochondrial biogenesis and the
Wow.
efficiency of which the mitochondria can produce cellular energy from oxygen. So, telomerase, stem cells, mitochondria, that's what I call the unified theory of aging, and nitric oxide is what controls and regulates all three of those.
Wow. Yeah. So I am going to, we're getting close. I know you have a call soon. So what I want to do is share your website. Let's go here. Now I found two. So this is the NO2 2U, and this is yours, right?
Yeah, so we've got several companies out there. So, this was based on the progression and the development of certain technologies
Mm-hmm.
over time. We're trying to bring this under one. We've just gone through a corporate reorganization from Bryan Therapeutics Inc.,
Yeah.
a C Corp, and then we put our consumer products as wholly owned subsidiaries under there. But NO2U is my brand. We also have a brand called
Yes.
N101. We've got a suite of products.
That's this
Uh,
one, right?
for skincare, uh, dietary supplements, nutritional products, beats. Um, but yeah, so these are, my primary objective is to inform and educate on the importance of nitric oxide so consumers can make informed, educated decisions on what's best for them. Because unfortunately, most products that are sold as nitric oxide products don't work.
Right.
It's very frustrating for me to maintain the integrity of the field.
Mm-hmm.
Sometimes you have to call out these these bad actors that are
Yeah.
deliberately defrauding and deceiving the customers because they either they don't understand and appreciate the science or they fail to recognize the
Right.
science. But either way, they're selling products that don't work, and
Right.
it's important to call those out.
And I tried nitric oxide once, and I did feel a little more energy, but I didn't feel enough of a change back then. It came in a little pack. I don't even remember the brand, but it was a while ago because me and my investigations,
Right.
But I've actually ordered this one. I would
Yeah.
love eventually. I have to, to get this lotion. You actually put that on your skin. Is that what you use to now heal people who may have the diabetes bruising and sores?
The nitric oxide topical was really what came from my dad's
Yeah.
treatment. So this is a skincare product, it's a beauty product. It's not intended to treat,
Oh, okay.
cure, prevent any disease. But
Okay.
the basic premise of this is, and that's what we're developing as a drug product,
Yeah.
is it's a dual chamber. Again, nitric oxide is a gas.
Right.
It's not something you can put in a capsule. It's not something you can, it's a gas. We have to, if your body can't make it, then we do it for you. And that's what makes my products different from any other product in the world. We have an NO analyzer, a gas phase analyzer,
Right.
that we
Oh,
can
wow.
detect nitric oxide coming from these products. So
Wow.
we're not giving you precursors and substrates and hoping your body can make nitric oxide because that's the basis of the deficiencies.
Right.
So the skincare product is a dual chamber. You take one pump from each side and you mix it together, and then you apply it to the face. And actually, you can see this product working before your eyes because your skin will turn pink.
Wow.
It's due to an increase in blood flow. So we can see this in real time, and it's mobilizing stem cells. It's improving cellular turnover. We've got 6 published clinical trials where
Yeah.
improving collagen deposition, improving hydration, fine lines and wrinkles
Right.
get better. But we're developing that as a drug therapy
Right.
for diabetic ulcers and non-healing wounds.
That's amazing. So you have 2 books. People need to understand how big a part nutrition plays. This book is full of the secrets of nitric oxide. So
Well, that's the latest book. That the functional nitric oxide nutrition, I believe I published in 2017. So
yeah,
the secret of nitric oxide is I launched that book, I think, in February. So it's new, it's up
yeah,
to date, but it tells the entire story of nitric oxide, how it was discovered, what led to it, excuse me, what led to the Nobel Prize.
right.
And then it's a personal journey, my personal journey of discovery and product innovations, and
Yeah,
highlighting the struggles we had to overcome and the roadblocks and the opposition, and
I can just
it's
imagine.
to
Yeah,
hopefully inspire people to, if you're undergoing resistance or opposition of what you're doing, encourage people to stay the course because it means you're
yeah,
doing something extremely important.
yeah. Now I'm subscribed to you on my page. I just pulled this on a generic page, but
Yeah, I
this,
encourage people to subscribe to my
yeah,
YouTube channel because we we have a lot of information on there. I develop
Exactly.
a lot of content, some education information, but in no way am I trying to sell you our products on the YouTube page. My my intent is to,
Educate.
take the information and impart knowledge on you based on real science.
Yeah. I think it's so important. So you have so many good things here. And then if they can also get it on Amazon, the book, and all the books, you have that here as well. So, so I'm going to put all these links underneath, and so folks can find you either on your page, or if they forget what was his page, they can go to Amazon and find you there. So I just want to thank you so much. I'm telling you, like I took notes every time, I was watching. I was like, oh, I want to know about this and I want to know about that. So I want to thank you so much for your life's work. It's important.
Well, thank you, Jody, so much for your service
Yeah.
and protection of our country, and
Thank you.
all you warriors out there. And
Yeah.
we support our warriors. We give a lot of products away, and there's an organization called Gray Team, that we help and support prevent suicides from a lot of veterans, and it's unfortunate, and trying to give them the resources they can to get better. And we owe you guys our freedom.
Thank you so much.
Freedom
Yeah.
that we enjoy every day waking up. So thank you so much.
Yeah, people don't understand. Like when I go to Walter Reed, I'm part of the Disabled American Veterans, and we are veterans helping veterans. And when
God
you
bless
see
you.
these folks, and they feel, some of them feel like they don't have hope. Their limbs are gone. And legs are gone, and then you have to let them know that there is hope for the future, and that people do care. So that means a lot to me on behalf of my fellow veterans. So
Now, hope is a very, very powerful force, and
it is.
we have to maintain hope.
Yes, amen. So I thank you so much. If you come out with anything new, we'll be in touch, and we can have you come back on.
I'd love to.
Book. Yeah, that would be great. So warriors, everything will be underneath. Please take a look at this, especially if you have people in your family with diabetes, Alzheimer. Take a look. Buy his book, read it. And I believe there's hope for you. So we want to thank you for being here today. God bless you. God bless you. Thank you also for being here. And this was an honor, truly.
Thank you, Jody. My
All right.
pleasure and my honor.
All righty.